Okay, thank you. Goodbye for everybody. So, as a medical health officer, we work on this question of transport and health since the last 10 years. And we start to try to measure the impact, public health impact of the transport system on the health of the people of Montreal City. So we published a first report in 2006, Urban Transportation of Question of Health. I think it was the first report in Canada who linked the question of urban transportation and health. So we had a big media coverage, and we look at the different health outcomes in this report. As you can see, when you look at the transport and urban development policies and projects, you have on the one side the built environment, and there are two main components: the transport system, road network, public transport, cycling and pedestrian network, also the pricing, and you have the policy on urban development, residential density, land use mix, height, street connectivity, and the transit-oriented development. The choice of travel modes are linked with the transport system and the urban development. And you have also the environmental impacts of these policies on air pollution, noise, greenhouse gas, and also the health risk or benefit, depending if you are in the car-oriented development planning or transit-oriented planning. So what I will show you is some data from Montreal, because we start research on that topics with Montreal University, McGill University, since the 2006 about. So, as many cities in the world, we built our cities since the 50s as a urban sprawl and car-oriented development, and it contributes to many environmental and public health impacts. So, as you can see, and the same in major cities in Canada, you have the core centers of Montreal, highly densified, with good densification, and when you go in the suburbs, it's more and more sprawl because we built highways instead of public transit since the last 50 years. You can see in this slide the major highway system, the transport system. And you can see that with urban sprawl, people go more and more in the suburbs, and the population in the island of Montreal diminished since the last 40 years because of urban sprawl and the car-oriented development kind of urban planning. And with the origin destination survey, these are the numbers from 2003 and 2008, but you have also the same trend with the last OD survey in 2013. The motorization of household, it's much more important in the suburbs than in the central city of Montreal. Because you need cars to go to school, to go to work, or to go to take your to go at the shopping centers. So the motorization, it's in the suburbs, like in Laval, it's at about 1.4 car by household, and if you live in downtown Montreal, it's 0.5 car by household, because of the urban form. And you see in this slide that the distance travel based on place of residence it's much more important if you live in Laval, in the north or south part of the Greater Montreal area. And this has impacts on the environment. So we can link the distance traveled with the kind of car that people use. And we assess with McGill University, the engineer department, the greenhouse gas emission by ISO. For 2008, it's with the origin destination survey. And as you can see, it's fivefold more if you live in the suburbs, where the urban form gave you the mode traveled. It's mostly cars and long distance. So if you have a greenhouse gas policy to diminish the emission, so you have to work on this urban form and the system of transport that you provide to the people. If you look at the NOx concentration, it's mostly produced by car traffic. It's much more important along the highways, the major arteries, in Montreal City and in the suburbs. And we assess the childhood asthma rates attributed to road traffic from the data from 2006. And the cars who go to the center of Montreal City, these cars come from the island of Montreal and the suburbs. So the traffic in downtown is much more important, and we can measure the childhood asthma attribute to road traffic. And the rates, as you can see, it's more important for children living where there's major roads, and they live not far from there. We did also, because noise, it's a major problem linked with traffic. Many Montreal citizens complain from noise from traffic. And we did the first map in Montreal with about 200 sampling stations. And we did a land use regression, noise level, and what you can see in red and orange is the average exposure of the population for 24 hours, and it's up to 65 dBA to 80 dBA for 24-hour exposure. It's very high, and the WHO guideline for noise to avoid public health impacts is 55. So as you can see, and noise, I have some data where we pass questionnaire to those population, to 6,000 people, and those people living near the highways and major arteries are at least very annoyed. So you have the problem of annoyance, about 30% of the population. You have sleep disturbance and high blood pressure. So we are a lot of research right now to assess the public health impacts of noise from roads in Montreal. So you can see the proportion here of the population, highly annoyed by noise according to the source. So you can see the roads, it's 9.5% of the Montreal population. We're about 2 million population living on the island, so it's a lot of people. You have also the aircraft problems, noise problem, and the train. We did a lot of research to assess the injuries and the road traffic accidents Here you have the pedestrian injury in the road traffic. It's data from the police report from 2000 to 2010. So we geomap these injuries, and as you can see, there are much more injuries in the core center of Montreal City because you have the volume of circulation. The VKT, it's much more important in centre-ville de Montréal than in the suburbs. So you have this specific issues that people take their car to go to work. The major work place where people go, it's downtown. So you have this movement from the morning and the afternoon. It's explaining why you have so many traffics in the core center of Montreal. And you have this dose-response relationship between the volume of traffic and the number of pedestrians who has been hit by vehicle. So if you want to reduce injuries, the evidence is to reduce the volume of traffic going in downtown Montreal, the VKT. So we provide these maps. This is the hotspot in the downtown Montreal, and we provide these maps to politicians that you have to work on that. And there's many strategies, but one of principal strategies, as I told you, it's to reduce the volume of circulation and to implement traffic calming measure to reduce the speed of the car. When you look, it's a good news. When you look at the residential density, access to public transit, and proximity of businesses and services, it contributes to increase transport-related physical activity and better health. So the good news that the core center of Montreal, where you have a lot of housing per square meter, so high density with proportion of dwellings having access to commercial establishment and services nearby at walking distance below 500 meters. So it's always in the central neighborhood of Montreal City. You have a good public transit, very efficient, like the subway, Montreal. When you put all the three together, I will pass this one, you are much more in the physical activity of transport, and we can measure. We measure the prevalence of adult obesity. In Montreal, it's statistically significant that it's lower in the major central neighborhood because people are much more physically active because of the transport, utilitarian transport. And at the same time, we assess the rates of cardiovascular disease avoided by active transportation, like the inner city of Montreal, and the rates are significantly lower than if you live in the place where everything is in the urban sprawl mode. So you have the real evidence that we measure in Montreal. So those people living in downtown, in the middle city of Montreal, are much more physically activity. By example, people taking public transit in Montreal, they walk on the average of 30 minutes each day, 5 days a week. It's 150 minutes, and it's the main recommendation of World Health Organization of people physically active. So you have the real evidence that public transit prevents chronic diseases, and we can show it in Montreal. Recently, we have a major metropolitan plan for investment in transit and also in roads. And what we look, we look for the 2031 time range versus the public transit scenario. So we integrate all the major investment in public transit in the Greater Montreal area, like the prolongation of the subway to Anjou, the système léger sur rail in the suburb and in the West Island. And as you can see, the implementation of this public transit will have benefit impacts, especially on chronic diseases, the daily physical activity. So we will have a reduce also of NOx and respiratory disease associated with NOx. But in the meantime, the injuries, especially in the suburbs, will be increased because of the number of cars going up, unfortunately, in the suburbs. So our department work with Montreal City, with Agence Métropolitaine de Transport, and we advocate a lot toward a sustainable mobility policy. What we want to see, we want to see a reduce of vehicle kilometer travel. We want to see a stop in increasing road capacity. We want to no more highways. And we have to integrate much more the land use and transportation planning to put much more money in public transit infrastructure, and at the local level, design compact neighborhoods, traffic calming intervention, and active transportation infrastructure. And the challenge to do that, it's the challenge of the integration, horizontal and vertical integration. As you know, there's many policy with many structure, and we want to see this integration at the neighborhood level, at the Montreal City level, at the metropolitan, the provincial, and the federal. We have to work with engineers, urban planners, politicians, NGOs also are very active in Montreal to push the agenda and to try, because it's our main challenge for me, the next 20 years, it's to make our neighborhoods, our cities much more walkable, biking, and public transit. And with the greenhouse gas issues, I think it's the main driver. And we have to put in the mind of politicians that we have to stop increasing road capacity in big cities and put all the money in public transit.